Okay, folks, I think we are ready to proceed now. So if we can all have a seat, please make sure you do sign in sometime during today. I'd like to welcome you, those of you here in the room, and also those of you who are on the webcast, to CalRecycle's first workshop on Senate Bill 212, Pharmaceutical and Sharps Waste Stewardship Programs. My name's Howard Levinson. I'm Deputy Director of CalRecycle, and I'll be your moderator, facilitator, timekeeper today. This is an extremely important and ambitious endeavor for CalRecycle. I think you all understand the nature of the problems that we're dealing with pharmaceutical drugs and sharps, the issues that they present to public health and safety and the environment if they're not managed properly at the end of their useful lives. So to address this, SB212 was enacted last September, signed into law at the end of September, to establish safe and convenient disposal options, management options for home-generated pharmaceutical drugs and for sharps waste. With today's workshop, CalRecycle, which is charged with the overall responsibility for implementing this program along with working with the Board of Pharmacy and others. With this workshop, we're initiating a conversation with you, stakeholders in this program, regarding the types of stewardship programs and actions that can achieve and sustain the goals that are set forth in SB 212. I want to talk a little bit about the timeline that we're under in getting this program going. The timeline for developing and implementing this program is extremely compressed. Statute requires CalRecycle to adopt regulations for the administration of the bill's provision with an effective date of no later than January 1st of 2021. And some of you might look at that and say, oh, that's 23 months away, it's a long ways off. It's not in the rule of rulemaking. To accomplish meeting that date in accord with all the provisions of the Administrative Procedures Act, we really are going to have to start the formal rulemaking later this year, in probably fall, late summer, fall of 2019. At that point, that's going to be we know this is going to be a complex rulemaking. We know this is going to be controversial in many aspects. And it's based on our experience, it's really going to take the full year that's allotted under the Administrative Procedures Act to complete that formal rulemaking. And so to have it done in time and submit it to the Office of Administrative Law and have it be effective by Jan 1 of 2021, we really have to start this, later this year on the formal rulemaking. So that gives us really only 6 to 8 months to conduct informal workshops like we're doing today, to solicit stakeholder feedback on kind of basic regulatory concepts, and then later on in the informal process on actual draft regulatory language, as well as conduct the economic analysis that's required as part of this rulemaking. That's something that has to be submitted to the Department of Finance prior to us starting the formal rulemaking. And we also have to conduct the required environmental reviews that go along with any rulemaking. Let alone meet all of you and learn more about what your perspectives are and what your concerns are about any of the provisions that we put forth over this time frame. I mentioned that this also is going to require very close coordination with the Board of Pharmacy, which I'm happy to report has already been happening. I want to thank Tim Lennox and Mary Jo Tobola from the board, acknowledge that they're in the audience today. Saw Tom earlier. I don't know where he went. Oh, he went down to the end. Okay. Little do I know. So given this very compressed timeline, we're going to be asking you to work with us on somewhat, compressed schedule. Our tentative schedule for workshops is as follows. We have the first workshop today. That's going to focus on draft regulatory concepts for definitions, covered entities and stewardship organizations, and for what's required in stewardship plans. We have a second, and this will be delineated more later on as well. We have a second workshop that's scheduled for February 27th, also at CalEPA, I'm not sure which room, but one of the hearing rooms here. That's going to focus on draft regulatory concepts, and I'm saying concepts, not draft language, but concepts related to reports, budgets, and records, financial provisions, enforcement, and a variety of miscellaneous provisions. Then, dates to be determined. Sometime we'll have a third workshop in the April-May timeframe and a fourth workshop in the May-June timeframe, where we will present actual draft regulatory language and solicit feedback on you, from you on that language. One of those will be in Sacramento, and one of those, the third and fourth workshops, one of them will be set here, one will be in Southern California. Some of this timing could change as we move through these workshops and we get more feedback from you, but we still have to shoot for the beginning of the formal rulemaking for fall of this year, for the reasons that I stated earlier. So today's agenda is pretty simple. We're going to have a staff presentation on those issues that I mentioned: definitions, covered entities, and stewardship organizations, and then stewardship plans. There'll be ample opportunity for Q&A and for feedback. We'll pause at the end of each section to take questions or comments, and then we'll keep moving through the day, and we'll kind of judge how we're doing. I may say, okay, time to move on to the next section, and then we'll take comments again and after the meeting, certainly in writing, things like that. Before I wrap up the intro, a couple of other things. One is I want to thank the CalRecycle team that's put this together to date, particularly to my left, Clark Williams, Cynthia Dunn, Heather Beckner, Russ Carter over on the far end there, our legal staff, Elliot Block and Kate Nitta, who's in the front here, and then the Board of Pharmacy represented by Tom as well. I want you to, in full kind of being full disclosure, I want you to know as stakeholders who are going to want to talk to us, and we want to talk to you, that we're in the process of hiring new staff and a new supervisor to fully run this program and develop and implement it. It's been a scramble to do that since the bill was signed, and we hope to have most of that team in place prior to the February 27th workshop. So I know that many of you want to meet us, and we definitely want to be talking to you, and it'll be some of the folks that are here, but we want to have that team in place so they're meeting you right in front, they're getting to know you, and vice versa. So if you can bear with us for a couple of weeks until we get that team in place, it'll really help. Meanwhile, sometime today, for those of you who do want to have one-on-one meetings with us, give us a card, come up after the workshop, let us know so that we can get a running list and start getting things scheduled as best we can. So appreciate your indulgence on that. Most of you are not familiar with CalRecycle, and most of CalRecycle is not familiar with this industry, so this is going to be, even with that compressed time frame, it makes it even more critical that we have a lot of back and forth communication. Last couple of things, just a couple of meeting logistics. For the webinar folks, if you do have comments, you can send them to the following email address. It's Pharma Sharps, PharmaSharps, 1P, at calrecycle.ca.gov. So feel free to send comments in, and as we can, we may not read them in their entirety if you give us a long diatribe, but we'll condense them and at least try to portray the gist of what you're commenting on. Just a couple of logistics. Restrooms, for those of you who aren't familiar with this building, go out the doors in the back and take 2 lefts, and the restrooms are just over there. We won't have a break, but feel free to get up and stretch. There's a cafeteria downstairs if you need to get a cup of coffee or whatever. And then lastly, if there is a fire drill or a real emergency, there will be, obviously, the bells will go off and there'll be some instructions from building management. Typically, what we will need to do is follow us out the back door. We will go down the stairs. Depending on the nature of the drill or the emergency, there'll be one set of stairs or another, and we will go across the street and locate for safety in Cesar Chavez Park. So follow us and we'll keep you safe. So with that, I'm going to go ahead and turn this over to Cynthia Dunn, who's going to be the primary presentation, and I'll give you the clicker. And again, thank you all for being here, and those of you who are on the webinar for listening in.
Thanks, Howard. I just wanted to start, play with this, make sure it's not too close. I wanted to start by just kind of clarifying the purpose of rulemaking and what we're here to do with the 212 regulations. Regulations are primarily, first and foremost, to clarify statute and set up the necessary administrative procedures to effectively implement the law. It's also really important to provide a level playing field so that every manufacturer or stewardship organization is held to the same standards with respect to stewardship plans, annual reports, and other requirements. And like Howard said, specifically our purpose here today and of next month's workshops are to gather the early input on the definitions and processes that should be clarified in statute so that we can develop that draft regulatory language and share that in time for the third and fourth workshops starting in the spring. The next slide, I wanted to go over just a really high-level overview of the implementation timeline. Our informal rulemaking is beginning now. So thank you all for coming and participating, and we hope to continue to gather others as we move along the process. By April of this year, industries to provide lists of manufacturers and brands to the Board of Pharmacy, and we'll be talking about that in just a minute. January of 2021, CalRecycle's to have its regulations adopted. In July of 2021, stewardship plans are due to CalRecycle. The next slide just has some little bit farther out dates. Stewardship organizations are to provide the first annual report starting in the end of March 2022. And in 2023, fiscal year 2022 and 2023, CalRecycle sets the administrative fees for the costs associated. So again, didn't want to get too into detail today, but wanted to provide a little bit context for the timeline that we're working under. Again, not spending too much time, but some key components of SB212. And as you see the list here, they're very similar to existing programs that CalRecycle oversees, paint, carpet, and mattress stewardship programs. They all require stewardship plans to be submitted to CalRecycle. This one's a little different because their plans have some steps to go through prior to submittal to us, and Tom Lennox is here to speak to that a little bit. There are minimum convenience standards set, annual budgets and annual reports, again, similar to other programs. So really what I wanted to provide here is, as Howard stated, this is a new industry for us. These are products that we generally don't have purview over. So while we are on a pretty steep learning curve, I'll admit and be frank about that. That's why you're all here, and the expertise and knowledge in the room is really going to help us move forward. We do have expertise in this kind of approach. So I don't know if that helps allay concerns, but we'll be moving forward pretty systematically. Slide 7 is the outline of the draft regulatory concepts that we're going to be going over today. Specifically, these are the articles that are found in statute, and the ones in bold, Articles 1, 2, and 3, we're going to cover today at this informal workshop. The February workshop is going to cover Articles 4 through 7 on those provisions. Specifically with regard to the first 3, in more detail, these are the sub-bullets or the items and topics we're going to be covering today. I hope everyone has had a chance to print out the discussion document that we posted yesterday and sent out via our listserv. There are some copies on the back table, so I encourage you, if you need a copy, it'll be really helpful for you to go ahead and follow. Staff sitting at the panel here are going to be sort of taking turns covering these. And as Howard said, we're going to pause briefly afterwards. We have some questions that we posed in the discussion document we're going to be starting with. They're just sort of beginning questions to get the discussion going. So we encourage you to share other information, even if we're not specifically asking for. We're really looking forward to that robust information gathering from you all today. I'll go ahead and get things started with Article 1, definitions. These are the terms that we've identified in the first 3 articles that we think may require clarification in regulations. So I'll be going through each of those. At the end, for each, we're going to want to know things like, are there other terms in Articles 1 through 3 that you think should be clarified? Are there examples? In some cases, we provided examples for these terms where maybe these terms have been clarified in other regulations, so we provided those just for context and for discussion. Are there other examples that we should be looking at when we're thinking about defining these? And do you have any other suggested examples? So as I go through them, just be thinking of those questions are sort of the first start for us to ask. An extremely important definition in SB212 is the definition of covered entity. It's important for all of the entities to understand what their obligations and responsibilities are and when they might fall under the definition. It's a tiered definition that begins with a manufacturer of covered products in the state. If that doesn't apply, it moves to the distributor that is licensed as a wholesaler. And if no entity meets those definitions, it becomes the repackager. If none of the above apply, the owner, license, or licensee of a trademark or brand. And then lastly, if none of the above apply, the covered entity becomes the importer of the covered product. What we would like to have during the discussion, you'll see here on this slide, we have questions, are there examples? So the nuances and complexities of when an entity might fall into or out of any one of these descriptions, these terms, are something that we would like to learn more about and would like to know more about. The next slide has the actual regulatory text. So your discussion document has that. I'm not going to read it, so. The statutory language, sorry. Slide 12, the term under the Stewardship Plan section states that plans must demonstrate adequate funding for all administrative and operational costs of the stewardship program to be borne by participating covered entities. And on the next slide, we've provided, we're suggesting that administrative and operational costs should be further defined. The next slide and in the discussion document shows some examples in our existing producer responsibility programs that aren't exactly the same, but there might be something in there that can generate some discussion. So we provided that for your consideration. The next term is significant change. Also under stewardship plans, it states that a program operator shall submit any significant changes to a stewardship plan in writing for approval by the department and shall not implement the changes prior to that approval. Slide 15 shows as an example from the mattress stewardship program how significant and material change is defined. This is also something that we have found is necessary to be defined. I think this particular term warrants just me reading through it. For example, in the mattress program, it includes a change in a required element of the plan that affects the organization's costs or revenues, such as a change that results in the modification of the recycling charge, a charge that requires a party other than the mattress recycling organization to make a major change in how it participates in the program, or a change that reduces the goals set for the organization in the existing plan. Slide 16, Homebound is mentioned in 42032.2, and it says to permit an ultimate user who is a homeless, homebound, or disabled individual to request prepaid, pre-addressed envelopes. And we suggest that homebound should be clarified in regulation. And the next slide shows a Medicare definition of homebound. So we would like some feedback on whether that's an appropriate definition to use or to build from. Slide 18. Another plan requirement uses the term technically feasible that we suggest may need to be clarified in regulation. The next slide, thank you. Good faith negotiations is a term we suggest should be defined in regulations, and this is in regards to the stewardship plan, the authorized collector. If an authorized collector expresses interest in participating in a program, that the program operator shall commence good faith negotiations. Similarly, reasonable effort Section 42032.2 says that a retail pharmacy shall make a reasonable effort to serve as an authorized collector as part of a program. We're suggesting reasonable effort should be clarified. So those are the terms that we've identified. I'll go ahead and run through the questions. So I'll start first. Are there other terms from Articles 1 through 3 that anyone suggests should be clarified in regulation? And we have mic runners that will.
So the way we'd like to run this, we'll have someone bring the microphone to you. If you can state your name and affiliation, so we start to learn you, and also folks on the webinar can hear who that is, and then we can go around the room to see as many comments as we have. While we're getting the mic to you, sir, I just want to reiterate something that Cynthia said. One of the reasons why we are looking at many of these terms is based on our experience running other stewardship programs. We run 3 programs. We've had extensive experience over the last 7 or 8 years looking at those programs, evaluating them, holding them accountable, and we have found that we need to clarify these kinds of terms in regulations in order to make that process go more smoothly and to lay out expectations for everyone, both CalRecycle and the regulated entities. So just a word on that. I also want to say, for those of you who aren't, I meant to say this earlier, aren't familiar with CalRecycle, this kind of informal back and forth is something that is our MO. We like to do it for a longer period of time than we have available for this particular program. We ran for SB1383, we did 13 workshops over about a 24-month period. We don't have that kind of time frame, but we want to make sure we are as available as possible to you for this informal back and forth before we really get into the nitty-gritty formal rulemaking. So, given that, did we get a microphone? Okay, coming to you.
Thank you. My name is Landon Miller. Name of the company is Emerge. The back half of this program, I assume that you're coordinating with the California Department of Public Health because all this stuff is medical waste, infectious medical waste.
We've had many discussions with the Board of Pharmacy. We've also had discussions with the Department of Public Health, and we'll get into that issue in more detail. And Laura, do you want to provide another response?
No,
Well, there's a specific reason why I asked this, is talking about terms to be defined and clarified. You used a term in one of your earlier ones that said rendered unrecoverable or unrecognizable as part of your definition. And that's a term of art from the Department of the DEA's, which is a part of the Department of Justice. So I wanted to know if you were relying on that definition or what you meant. Thank you.
thank you.
So some of the information on the slides were information taken verbatim from statute, and then we actually identified some terms from statute that we thought needed further definition and clarification. I don't believe rendered uncoverable was one of the terms we identified as further defining. I think that might be from statute explicitly, so we'll take a look at that. And if that's something you're proposing needs further clarification via regulation, we can look at that as well.
Sorry, we need to have you speak with the microphone. Thank you.
Yeah, I would suggest you do that because you could have a federal preemption term there from a statutory perspective.
Thank you. So mic runners, make sure that you stay by the commenter in case they have a second comment.
Larry Sweetser on behalf of rural counties. Haven't digested all the definitions, so I'll probably have comments later on some, but my comment right now may focus on reserving placeholder definitions. One of my main concerns is how these programs are going to interface with household hazardous waste programs, how they're going to interface with load checking programs that collect material, how that fits in there. So that may prompt a need to have definitions in there. And I'll elaborate on those questions later.
Thanks, Larry.
Any other comments on this? You know, it strikes me that at some point, and we've had many discussions over the years about the Medical Waste Management Act, federal overseeing regulations from DEA, household hazardous waste, solid waste, and where these where home generated sharps and pharmaceuticals all fit in that. And frankly, it's not real clear. I think the statute does provide us the opportunity to make some clarifications on that with respect to home generated pharmaceuticals and sharps. So that's definitely something we're going to have to be looking at, and that's something you all will have to pay attention to as we get further into the details of the language. Yes, sir.
So Mike Van Winkle with Med Project. I'm the executive director. Med Project, just some context, is the organization that is implementing the pharmaceutical drug take-back programs here in California. We're also operational in Washington, Massachusetts, and New York. My comments in terms of the definitions is that we would agree that significant change is very useful to define. We think the way that you're putting in context initially with regards to the mattress recovery is in the right track, and we be happy, and we will provide some additional comments in terms of the level. But it's really important we think about standing up these programs to ensure that you have the right view to significant changes, but it still allows some of the flexibility for what might be considered and agreed to as a de minimis type of change. So thank you for that.
Thank you. I think that's really important. It's been our experience with the existing programs. That's a line that we want to make sure is that there is enough flexibility, but when does something rise to the level of being a significant change to trigger more action? So thank you. Anything else on that particular question? I'd like to ask with regard to the definition of covered entity, that tier definition, are there any other terms within that tier definition that there should be some added clarity?
And while you're thinking about that, I just want to let folks know that there will be plenty of opportunities for providing comments on the definitions, even though we're moving on throughout the course of today, the next workshops, the draft regulatory language. We know there's going to be a lot of back and forth on that. So don't hesitate later on to say, oh, I thought of something that I think is important, and we'll have some formats or some mechanisms for how to submit comments to us. Any questions about covered entities? I see a hand back there.
Hi, Celine Hoboy with Stericycle. Actually, mine's more related to, the question is related to the public comment. It says public comments are encouraged by 2/15/19. Is that to what was released or sent out yesterday? Okay.
Yes.
So that's like in 2 weeks.
Yeah, this is just, since we're going to be moving on to the Articles 4 through 7 in February, we would like to get initial feedback on the first 3 articles relatively soon so that we can put out another discussion document for Articles 4 through 7 and then get some early feedback on that. Again, this is just starting the conversation. We're not expecting, there are going to be a lot of opportunities to comment. This is just the input that we get is really going to help us put together the draft regulatory text that we put out in spring. So it'll be helpful to get those as soon as possible. And again, we know it's a compressed timeline, but we're going to need every bit of this time period to put out the best language possible. So yeah, thanks.
And just to build off that response, this won't be your only chance to comment on Articles 1 through 3. It just allows us to get that information earlier and advance our thinking on where we need to go with the regulatory process. So that's a little bit more further developed when you have a chance to come forward with regulatory text. So it's not your only bite of the apple in Articles 1 through 3, but if you get in by the 15th, it allows us to produce hopefully a work product that's responsive to your thoughts.
Hi, Leah with HDA, the Healthcare Distribution Alliance, and thank you for CalRecycle for opening this up. We do have significant concerns with the covered entity definition that we've expressed to you all. Essentially, that it's fairly ambiguous as to when the definition would trickle down, what constitutes a manufacturer, what wholesalers would be responsible for, et cetera. So we're happy to share those concerns with you and definition ideas, but that is an area that's a significant concern for industry.
Thank you. And I'll just add also that we will be talking about that a little bit later in this presentation. What we're discussing here is purely the definition. A little bit later on, we're going to talk about the department's requirement to outline the process to determine a covered entity. So thank you. Does anyone have any other questions?
Yeah, there's another comment.
Oh, I'm sorry.
Just a clarification, maybe Mr. Lennox could clarify. Is a manufacturer, does that definition include compounding pharmacies?
I think it's going to have to depend on the way the board's looking at it. At least presently, it's going to look at the type of license that you have. So if you have a manufacturer's license versus just a straight up pharmacy compounding license, because I don't think pharmacies directly are covered under this. But I got to look at how that's, we're still looking at how this is all going to play out.
Okay, thanks. Are there any other questions? Again, one of the things we were wondering, are the examples that we provided, are those good examples to work from? Does anyone have any other examples? You don't have to share that now, but if you can and would like to in writing, ideally again by around the 15th, that would be great. Okay, we'll go ahead and move on to slide 22, which is Article 2, Covered Entities and Stewardship Organizations. This article covers the topics of submittal of manufacturer product lists, criteria for determining covered entity, and education and outreach. Slide 23, I'll just note that we're very thankful we have Tom here who can say a few words. The submittal of covered product lists to the State Board of Pharmacy is not something that we're going to be defining in our regulations because that's not our purview, but Tom can say a few words to this. Thank you, Tom.
So I think the key point is say a few words. Right now, as it's set up, by April 1st, we need to start receiving the list of products, list of covered entities to the board. We're looking at trying to bring on more staff, so that's probably not going to happen for a while. We're looking at, and we've been trying to to see through some of these other programs that are out there if there's already a system in place as to how this reporting is being done. So far, we haven't found anything that's as detailed as what's being required here. So we're looking at drafting some templates. I would like to get the information electronically. We need to try and engage the people in this room to find out the volume of what's going to be coming in, because we have no idea how much is going to be coming into us, and we anticipate it's going to be fairly voluminous and extensive. So at this point, we're going to ask for your patience in working through this process. It's a new process. And we are reviewing our current regulations to determine if we need to make any changes with the board regulations in relation to the SB212.
Thank you, Tom. Appreciate it. Slide 24. Oh, is there? I'm sorry, there's a question.
Hold on a sec. Let's get the mic. And if you can state your name and affiliation, please.
Green. Carrie Hoffman with PBSWG, which is the Pharmaceutical Product Stewardship Work Group. My question is, do you anticipate providing guidance for those that have to make that submittal prior to the submittal date?
We hope to, and that's our goal. Again, we've only had a short window to do this, so I'm not confident that we're going to meet that goal. but that's what our aim is for.
Okay, because I know that we'll get questions from our, members that will rely on us to provide potential guidance. So.
There's going to be a lot of questions.
Speaking of questions, this is Heather here. Is there anybody in the room that has had to submit any type of list that covers the information that's being requested? Because that may help guide us and the board as a template is divided. Prepared.
Microphone's coming. And again, if you could restate your name, please.
Sure, it's Landon Miller, Emerge. The FDA requires, as Mr. Lennick would know, all the kind of information that you're probably looking for by what are called NDC numbers. But that only fits certain categories of what is probably intended to be covered by your act. So, like nutraceutical, I never can say that right. Food additives that are intended to, treat a disease that maybe come from a foreign country, that's I assume covered under this, but which you're going to have to scramble in order to find.
And then Leah Lindahl again with Healthcare Distribution Alliance. Our members do often, wholesalers will provide lists to states, so in Washington's law, in New York's law, and then several of the cities and counties, wholesalers would report in on what drugs they're distributing into the state or the city or the county. There's also, as Tom's very well aware of, the DSCSA, the Drug Supply Chain and Securities Act federally will go into effect in 2023. And that's essentially, from what the gentleman before said, the NDC number. They're kind of working on that and expanding that program so that every drug product is actually traceable. So by 2023, the drug product will have a specific serialization and a number attached to it. So you can track it back from the manufacturer to the whole supply chain and every process that that drug had passed through.
So Tom, I'll just ask you whether you need additional information kind of regarding these processes, or you're familiar enough. I know you have a staffing shortage, but one of the ideas here is that if we can come up with a template that will make it somewhat easier to submit electronically and it's consistent so that we then don't have to sort through all kinds of varying formats and things. So I'm not sure what at this point you need, but.
Well, I think it's going to go beyond products that have NDC. So that's, I think, what's going to cause the issue. And then trying to figure out those products, and we're going to have to be reviewing those products and see where they fall. And so that's, I think, what's going to become part of the issue is getting all of those other products in there. I like the idea we could do it NDC because that's going to pretty much cover, hopefully, most of the product out there. So if that's one way, and as a consensus by a group, because clearly nobody's doing this already in the format that SB212 requires it. So if you think that that's going to be beneficial, then we can sort of look into that and do it through the NDC codes. I like that idea.
Thanks, Tom. Any other comments on this? Okay, go ahead, Cynthia.
Okay, so we covered the definition of covered entity, and Leah, this gets to what you mentioned. The statute requires the department to adopt regulations on the process for determining what entity is a covered entity, following the priority order of the tiered definition. So this, as I mentioned earlier, is one of the areas where we're really looking to the industry expertise and knowledge base of stakeholders to help us understand some of those nuances and complexities to help us identify the most appropriate covered entity. Slide 25 has some initial questions that we had. It's not a comprehensive list, but hopefully it'll help generate some discussion. We're wondering questions like, where do online sales fit into this process? What is the role of reverse distributors in the process? Where do they fit in the definition? Under what circumstances could a reverse distributor be considered a manufacturer of covered drugs? Where would a retail pharmacy chain that's also a repackager of covered drugs fall within the tier definition? Again, we don't have to go through one by one, but those are the kinds of things that we're wondering. So if anyone has any thoughts to share, or other, we don't even know if we're asking the right questions, so please let us know what questions we should be asking that can help inform regulations on determining the process for determining the criteria for determining covered entity. And this could take some thought, and we would, we welcome written comments, but if there are any initial thoughts in the room, or maybe, looks like Landon has some thoughts, and I'll just kind of
Robert.
check and see, do we have any email?
Raise your hand again. Yeah.
Sorry, I'm not trying to hog.
No, that's okay. We want comments.
Okay, so
Plenty of time.
the, the process for returning various categories of drugs, each has its own sets of rules and regulations at the federal and state level. And so, reverse distribution is commonly only part of that, and there are a new set of guidelines just put out by the FDA with regard to reclassifying some of the statutory stuff that's going on in that line of that particular part of the line of commerce. So rather than spend a long time talking about that, I just suggest that you look into all the various types of programs that exist out there under the general title of reverse distribution. And I think question 3 kind of addresses my question about compounding pharmacies. Thank you.
Thank you, Landon.
Thanks, Landon. And I'll just restate what's been stated previously. This is a new area for us as a department to work in. So if you have specific entities or even contacts of those entities you think we would benefit from a conversation with about reverse distribution and this definition, we'd really appreciate you sharing those with us.
Howard, I'll note that there's a question that came in through our webcast.
I believe it's more of a comment. The definition for retail pharmacy chain should clarify whether mobile operations will be counted as separate entities or if all of a company's mobile units will be counted as a single pharmacy for the purposes of meeting the definition of a chain. And this was from Carlos Chavez.
Thank you.
Thanks for those comments, Carlos. And if you want to chime back in and inform me what mobile units are and how they work in the state, I'd appreciate that.
We just have a technical glitch on our screens up here. We can see the slide back there, but they're not showing up on our screens here. So I'm not sure we can get that fixed quickly.
Maybe Russ, if you could check with our AV folks. So thank you. Okay, we're on slide 25.
You may have to just, oh, there you go.
Oh, there we go.
Thank you.
Thank you. Okay.
It's a new AV system. Looks like they're on top of it, so thank you.
Yeah, thank you, AV. All right, slide 26. Article 2 also requires that a program operator conduct a comprehensive education and outreach program. It states that at a minimum, this program should promote the stewardship program to ultimate users, providing signage to certain entities, providing educational and outreach materials for persons authorized to prescribe drugs, pharmacies, pharmacists, ultimate users, and others, establishing a website that publicizes the location of authorized collectors, and to promote the use of the program, and prepare and provide additional outreach materials not specified in the section as needed, as well as encourage ultimate users to separate products that are not covered products from covered products where appropriate. So the questions we have are, as you see in bold on the previous slide, is any clarification needed to comprehensive education and outreach program? and what other outreach materials may be necessary. So to what extent should this be specified in regulation? Pause for a moment, but happy to move on. Okay. Oh, Larry?
Larry's got a comment.
Okay.
Larry Sweetser again on behalf of the rural counties. And I don't see it specifically prohibited in there, but I just want to make sure it's clear that, because jurisdictions will provide education efforts on their household hazardous waste program, and they collect these materials. So hopefully we can add that information into our local materials and have the program pay for it rather than coming out of pocket of a jurisdiction. Rather than sending a separate notice about the program, we can include it in there and get some offset costs for that advertising.
Before we move on to Article 3, we've got another email comment. Nikki, go ahead.
This is from Carlos Duke. He's asking if there would be a required or mandatory training that would need to be provided to an employee that collects medication and sharps, such as HAZWOPER for hazardous waste.
It's a good question. It's something we'll have to consider. It might be something that is a requirement for the plan that's submitted by the stewardship organizations as to how they're going to ensure proper handling. So I'm not sure exactly how we'll address that, but that's something we'll have to look at for sure. So thank you.
And if I could, Larry, I'm glad you have the mic here. I just want to follow up, make sure I was following your comment and interpreting it correctly. So what I heard you say is that a comprehensive education outreach program should involve kind of both coordination with local government education outreach, but also a funding component for those efforts?
Correct. Local governments are always looking for funding these programs. Funding's tight, and if another program is required to advertise, maybe we can do double duty and not create another piece of paper.
Thanks.
And if I may, I might have a little bit of an answer or direction on the training question. As somebody who does train on HAZWOPER, I would not recommend making that the standard. There are other types of trainings. OSHA requires appropriate training. There's a number of ways to get that training done, which is essential, but don't use HAZWOPER as the model.
Thank you. So now we can, unless there's other, we do have another comment, sorry.
Again, Mike Van Winkle from Med Project. So looking at your education outreach program, item 3, where you talk about the internet site, and again, being supportive of a system that would locate all of the collection sites, authorized collectors, local law enforcement, where that is present. That's also a very useful way to provide to the residents where the most convenient location could be. So that would be the support of that particular item.
Thanks, Mike. And I'll just note that item 3 there is statutory language. And so if there's any need to elaborate on that further, or if there's some reason where we may need to build upon what's in that statutory language, feel free to follow up with us.
I will say we have found that in the stewardship programs that we do oversee, that the issue of convenient collection, although this is defined more in statute, but providing that kind of information has been critical, and it's not always been easy to get. So this is probably an area that we may need to clarify, but we'll have to look at that.
Okay, we're going to move into Article 3, Stewardship Plans, and note that this is a fairly large and significant section that is on the Stewardship Plans. So we have identified the 8 processes listed here that are related to plans that will likely need clarification and regulation, and the first of these is being the format of the submittal of the plan. So within 6 months of the adoption of our regulations, a program operator will be submitting a plan to the department in a format determined by the department. So there is an existing example of some of the format requirements that we're borrowing from, again, from our mattress regulations that include several elements. And again, we are proposing modifying the language to align with the pharmaceutical and sharps terms that are in 212. But some of the critical elements that we believe are needed are obviously the name of the stewardship organization and then the contact information for the manufacturers, which would include name, mailing address, web address, and then instructions on if there's electronic submittal that's acceptable as long as it's accompanied by a hard copy submittal letter with the signature of the representative of the stewardship organization, and then other information that may be requested by the department, including contact information for all the participating stewardship organization members. So again, this is just an example, and some of our questions for you all are regarding whether or not there are other elements or requirements that should be included, or if there are other formats from any other existing local ordinances that may more adequately capture the critical components. Again, this is just on the format of the submittal, not the plan requirements. We'll get to that.
Thanks, Heather. And I'll also just point out, for those of you following along in our concept document, we're on page 6 right now. And so the information on the slide was just a small excerpt of the larger information we have included in the concept document of other requirements that are in the matches program that especially might be a base to build off of. So if you want to take a look at page 6, you can as well.
Thanks, Clark.
So comment to that, Bill Grimes with Santa Clara County. I would just submit that the local ordinances are a better template, I think, as a starting point than a mattress template. The formats of the plans have been pretty well delineated in a lot of the local ordinances.
Are there particular ordinances, and you don't have to answer this right now, but if there are particular ones that you think are better suited for as a format, you let us know.
I think mine are especially good, of course, but I'll get back to you.
Very good, thank you. As you can see, Heather delineated, showed the slide that had 8 different processes that we are going to talk about today relative to plan format and submittal and so on. We're going to walk through each of those and give you an opportunity after each one to provide comments. And then if you think of something, we're on number 7, and you think of something about number 2, that's okay if you provide that input.
Howard. I know this has kind of been touched on before. So with regard to the submittal of a proposed plan that goes to the Board of Pharmacy, statute also outlines that it could go to any other applicable state agencies. So we have identified some potential agencies, which are on the next slide, that may have authority relative to the plan, and then noting that this is going to vary depending on what is in the individual plans that are received. So are there any other agencies that may need to review a proposed plan besides Board of Pharmacy, CalRecycle, and the others listed here?
I would suggest, this is Landon Miller from Merge again. I would suggest the state and federal Department of Agriculture.
Thank you.
And can you elaborate a little further on specifically which entities within Department of Food and Ag here or USDA?
Well, specifically, I'm not sure whether it covers up this particular subject or not, but programs like APHIS. Okay.
Thanks.
Okay, any other?
And this is one where I think there's, the question's phrased here, which other applicable agencies may have authority relative to the plan. So I think, there'll be a lot of coordination with a number of different agencies, and then there's a question of which ones have authority or necessity to be involved in these processes. So we're going to have to, parse that all out.
Yeah, and just to build off that too, specific examples of where they might have authority just over pharmaceuticals, where they might have authority just over sharps, to help us kind of hone in where we target and coordinate with those entities.
and I'll just throw this out, and this is not something we've talked about internally, or at least that I know about. I was on vacation for a while. There's also the issue of plan approval, which we have authority for, and it may be that some of these things it could be that if coordination with some of these agencies is necessary, that may be something that we want to require as part of the plan itself, that the stewardship organization has to show how it's coordinated with entity X. So I'm just throwing that out for a possible way of handling this. So. Go ahead, Heather.
I have a couple emails that I can read before we move on. This one's a little lengthy, so bear with me. Alexander Fung said, we have a large number of immigrant populations residing in the San Gabriel Valley, with many of them only being able to speak Chinese or Spanish. We strongly believe that bilingual materials should be specified in the rulemaking language, especially for communities with a high percentage of residents that speak languages other than English. One question we would have in addition to the above comment is that which entity would be responsible for translating, reviewing, and approving the bilingual outreach materials?
We certainly recognize that there's a large user in the state of home-generated sharps and pharmaceuticals, and the need to kind of reach them in the language they speak. I personally haven't given any thought to who would do the translation, or if that's something we need to clarify either in regulation or ask the stewardship organization to address in their plan itself. That's something we can give some thought to.
And I will suggest to you all, staff-wise, we've got another comment that we have another regulatory package that's just entered its formal rulemaking period. It's the Senate Bill 1383, which deals with organics, but there are draft provisions in there relative to identifying other language types that need to be covered by a program. So we may want to look at that as an example to spring from.
If I might, Bill Grimes, Santa Clara County, we found that we had to implement in regulation the definition of required languages for purposes of outreach and education, and I think there are 8. We placed those obligations on the plan operators, but we've also entered into a master contract with translation services to vet those materials prior to approving their incorporation in the program implementation.
Thanks, Bill. Nikki, did you have another?
Yeah, one more. Sam Martinez said, what is your opinion on USP 800 identifying many non-chemotherapy medications as hazardous? Do you feel they should be wasted the same as chemotherapy medications?
We'll take that comment. I don't think we can respond to that on the spot. We'll certainly look at that. Unless, Tom, if you have...
No, I was just going to say we had some discussion on some of these issues in our last joint meeting, so these are some of the things that we are looking into and trying to address, so we're aware of some of those issues.
Perfect. Thank you. That's it.
Okay. We'll move along to the agency determinations. So after stewardship, a program operator has submitted a proposed plan. That agency has the responsibility to review for compliance with state and federal laws and regulations related to their respective authority. And then after they've determined compliance or non-compliance, they will provide to the program operator a determination on that finding. So our question is what information should be included in that determination, and then what the format of that determination will look like. Are we looking at a letter or an email from the agency director, and what other information should be in there?
And it's probably obvious to most of you, but I just want to reiterate that provision in there is so that we, CalRecycle, do not get plans that have not been reviewed by other agencies, and we may not have the particular expertise that, say, the Board of Pharmacy does or another entity, and we want to make sure that there's been a review prior to triggering our time frame for reviewing the plan that's submitted to us, so that there's a logical sequence going on here.
Regarding the timeline for resubmittal of those proposed plans, so if an agency has issued a determination of non-compliance, then the program operator may submit an updated plan and then include all determinations when they're submitting to CalRecycle. And we're just noting here that the timeline, it doesn't fall under our regulatory authority. So it won't be a part of our regulatory process. We're just observing that existing statute 212 does not specify a timeline for the resubmittal of revised plans. So not sure if those will be 30 days, 60 days, similar to what are our existing programs, but just noting that. Program operator certification that plan meets applicable laws and regulations. If a program operator submits a plan to a state agency and doesn't receive a response from that agency after 90 days, the operator may submit a certification that the plan is consistent with all other applicable laws and regulations. So to our knowledge, we're not aware of any other entities that may certify that. So besides the program operator, I'm asking if there is anybody else is aware of any entities that may do that, or is just a form of, quote, self-certification we're looking at.
Landon Miller from Emerge again. I would assume that all these plans have to include a disposal side of the plan, in which case they would all automatically have to be handled under the permits issued by a CDPH. Is that, I'm just asking.
I think that's some of the feedback that we're looking to get today. So, okay.
I would just note that there's a statutory requirement in here that other agencies have 90 days to review a plan, and if not, then there's this opportunity for certification. I'm not sure how realistic it is that they'll be able to make a determination within 90 days, so it'd be nice if we can get a sense from you who've worked with some of these agencies about this 90-day time frame and how often we may be getting plans that have determinations from the other agencies versus in a situation where it may be looking at some type of certification from the operator that their plan is compliant.
More to think about. So similar to the discussion on the determinations that are received from other agencies, what information should be included in the certification that's submitted by a program operator, and then what an acceptable form, again, are we looking at a letter or an email? And then, and we've kind of touched on this, what the specific laws and regulations that a plan may need to certify compliance with for pharmaceutical plans, which are again going to be different from the Sharps plans, that may need to be included in the certification. And then this last question, it's probably more suitable for a future workshop when compliance and enforcement is discussed, but something to kind of be thinking about is what happens if the department or the Board of Pharmacy receives a plan and determines that the certification was made in error and the plan doesn't in fact meet the applicable laws or regulations. So it's just something to be thinking about.
Okay, any other thoughts before we move on? Okay, section 6 is related to pharmaceutical and Sharps waste stewardship plan submittal to the department. So 6A deals with the plan completeness process. Again, this is similar to our existing programs where several of our programs where we first determine that a plan that's submitted actually has checked all the boxes, that it includes everything that is required to be included. So this says that once all the boxes are checked, BOP's already signed off on it, and any other applicable agency, it submits to the department, and the department has 30 days to determine if the plan is complete and then notify the operator. So a question for stakeholder is, and I'll provide a little bit more context to this question. We're wondering, should there be a limit on how many times a plan can be returned for completeness deficiencies? The reason I bring this up is it's been our experience that it can be a process going back and forth, trying to get a complete plan before we can start our statutory clock to review for compliance and determine an approval, conditional approval, or disapproval. And that process of getting incomplete plans can be very time-consuming, not only for the submitter, but for the department as well. So I'll offer here too, just as Howard stated earlier, just to share with those of you who have not worked with us before, we personally like to work with a potential submitter early on in the process and a little bit more informally so that we don't receive a document that starts our clock and puts a lot of resources dedicated towards reviewing and having meetings and trying to determine compliance, completeness, and then compliance. So I'll just offer that for any entities who are considering submitting a plan to please contact and work with us early so that by the time something is submitted, it's pretty cooked and it makes the process go much smoother for everybody. So I don't know if anyone has any thoughts on that particular question, but I wanted to provide that context. Okay, we'll move on.
Yeah, and I'll just say that I just want to reiterate there's quite a difference in our minds between a plan being complete, having each section in the plan, and then what the quality or the potential effectiveness of the information in that section is. So there's, yes, you're complete. Now we're going to evaluate, does it really meet the intent and the details of the regulations and the statute?
Thank you, Howard. So 6B moves on to that plan approval process. So once the department reviews, determines that a plan is complete, it has 90 days from that point to determine and make a determination for approval, conditional approval, or disapproval of that plan. And this particular section 42032D1 delineates all of the items that go into the plan approval process. It does also say that should the department have to pause and consult with other agencies, again, that have purview and expertise beyond that of CalRecycle, it does put a stop on that time frame, that clock for that 90 days. Some questions for stakeholders we have with regard to plan approval process is we observe that there's a need for a timeline and process for resubmittal that is following a conditional approval or a disapproval. We've provided some examples, again, from existing stewardship programs and are wondering if those are a good basis for the plan approval process or timelines. As Mr. Grimes mentioned, maybe there's an existing ordinance where this kind of thing is already outlined and that works well. So we're wondering if anyone can point to other examples. Again, don't need to have a verbal, but if we can get written comments at some point, that would be great. I'm just going to pause here and check with Nikki to see if we have anything else from webcast.
We have one email I'm asking clarification on, and another from Steve Rodowick. He says, given the lower regulatory requirements on sharps relative to pharmaceuticals and considering sharp's simpler plan and of exclusive mailback, would it be possible to consider an accelerated plan implementation proposal for the sharps program relative to that of the pharmaceutical program?
If I'm understanding that correctly, I mean, once the regulations are in place, there is a certain time frame by which the plans need to be submitted. Certainly, plans from a sharps organization can be submitted independently in different time frame than a plan or plans from pharmaceutical-oriented stewardship organizations. So, we're not sure what we're going to get with respect to that. We anticipate at least one sharps plan and one pharmaceutical plan. It could be multiple ones. We don't know what you all have in mind yet, and so, but certainly they can be on different time frames. And that's where what Cynthia just said about working with us informally. Once once the regulations, we're sort of in the process and you see what the plan is going to have in terms of here are the goals, here are the mechanisms that we're going to use, here's the funding mechanism, here's how we're going to do education outreach. Once you have a sense of that, certainly start to work with us early on so that we can say, well, what about that provision? Or you need to provide us more detail on this before you submit the plan. So early back and forth will expedite that process as well. Oh, sorry. Yeah, go ahead.
So just to clarify, understand that you might get multiple plans and one pharmaceutical, one sharps combined, et cetera. I guess the clarification I just want to, both will be following, there won't be different rules applied. I want to clarify that. So if someone submits early, doesn't mean that they are applying to different sets of rules that are outlined in the legislation.
And I don't want to speak before we get to the next Part 7 and 8 on this presentation, because there may be some different requirements if you're doing a sharps plan, because there are certain goals for sharps and there are certain different goals for pharmaceuticals. So that'll have to be differentiated. But the regulation, there'll be one regulation that covers the entire set of regulated entities and provides direction. So the rules won't change. They won't be two different sets of rules that people have to be looking at, all be in one. Is that?
Yeah, I think that's what I was looking for, or two different sets of timelines.
I don't see that. No.
I believe the timelines are the same for each, so. Yeah.
I think it was just the question that came up in that email potentially opened that door. So.
Landon Miller from Emerge again. There's probably going to have to be 3 or 4 different kinds of plans because you have unused sharps. The vast majority of used sharps are probably going to be considered pharmaceutical sharps. In other words, they have residual or unused or maybe completely unused amounts of pharmaceuticals in them. Then you're going to have different types of pharmaceuticals that, as you're about to get into, require different sorts of security systems and so forth and so on. So I would suggest you're looking at a wide variety of plans.
Follow-up question, are you suggesting that because there are different types of sharps that they would require a different plan, that they couldn't be covered under the same plan that just outlines how they would be managed?
I think that's a complicated question. Celine from SteriCycle, their company has a national, international set of programs. We're a reverse distributor and we do different sorts of stuff. So, along with some of the stuff that they do. So I think you'd have to think very carefully about how you're going to do this, because when you include something that's infectious in another set of stuff that isn't, then it needs to be, in other words, the typical rule is it has to be handled to the degree that's appropriate for one thing that's in there, even though the other things might not be. So I'm just raising the issue at this point that says you got a lot of planning to do.
Thank you, appreciate that. Okay. I think we're on slide 44 now.
Go ahead, Larry.
We have a couple more. Okay.
And just to follow up on Steve's question, I think I'm wondering whether the same party that's involved in both pharmaceutical and sharps collections, if they could issue separate plans to deal with the sharps, because that's so much of an easier material to handle. And from my experiencing with household programs, I think most of the people using the sharps containers are the diabetics, which means they mostly have lancets. They may have needles in them that were used with medication, potentially infectious, but usually those needles would probably be empty. So I think it's less of an issue to deal with the sharps, and maybe it could be bifurcated in terms of plans. Submit a sharps easy one now and pharmaceutical later. That would be nice to have that as an option.
Correct me if I'm wrong. I'm sorry, Bill. Let me just correct me, you guys, if you think I'm wrong. But it seems to me that we are going to have to look at this in terms of making sure the regulations are flexible enough to accommodate different kinds of submittals. But a lot of this will be determined by you, the regulated entities, who have to come up with a plan to meet those goals specified in the statute. So we'll have to look at that and think about that more.
Yeah, I appreciate the concept, and I would just observe that kind of the first step in our process is getting our regs done. So we have by statute till January 2021 to get our regs approved and in place, and as Howard outlined at the beginning, we feel like that's ambitious. So realistically, us getting regs done and in place much sooner to that, I don't want to set false expectations that we can do that. And then statute says within 6 months, we need plans once the regs are adopted. So I see there being a pathway where maybe a plan could come in a month or two earlier than that statutory requirement. If it's really easy for us in our review, maybe it doesn't take us a full 90 days to do our compliance review. Once again, we're going to want to make sure we get robust stakeholder feedback and comments on these plans. So that 90-day review, maybe we're shaving a little bit of time off, but not much. So I think if it just doesn't seem like there's huge opportunities to get the sharps in much earlier than the other ones.
And let me just piggyback on that so you understand what we typically do when we get a plan. And once the regulations are adopted and formal and a plan is submitted, we take the plan and we post it on our website and we make it available to the public in general for comments. And then we receive that input as well in looking at our own internal evaluation of the plan. We then post we call it a request for approval. It's really an agenda item, and we will have an agenda item at one of our monthly public meetings where the staff makes a recommendation about that particular plan and says, yes, it's fine, and we recommend approval, or we have issues, and perhaps it's a conditional approval. So that process, typically, we usually post a plan and allow maybe 2 to 4 weeks for the public to comment. We develop our agenda item internally, and that has to be reviewed internally. So we are already into the second month of that 90-day at best. And so it's pretty hard to speed that up. Usually we are probably going to be on that in that third month, approaching the 90-day period. But we should be able to shave off a little. But there is that, again, this is CalRecycle's MO of making disclosure of information to the public and allowing for that back and forth to get public comment. I know we had another comment. Bill, go ahead.
I actually do hope, this is Bill Grimes with Santa Clara County. I actually do hope you're faced with some of these challenges. Our problems at the local level were a dearth of submitted plans, not an excess of them. So I hope you face that. But I wanted to circle back to 6A and 6B and just encourage you to, within whatever the statutes allow, to close those loops and bracket those time frames as best as you can. I think it's in the interest of all the stakeholders and especially the consumer. The number one question we get from consumers and residences and from elected officials is, when am I going to see a kiosk? When can I get a mail back? And the better defined the process is to getting to that implementation point without the back and forth review or overextended back and forth review, I think serves everybody's interest best.
Great, thank you. Other comments on sections 6A, 6B? Nikki, we're okay? Okay. You want to go on to 7 or, okay.
Okay, we're on slide 44. 7, plan requirements for covered drugs. I just want to note that this slide, you should refer to your handout or the statute if you have it. I'm sorry? Page 10 of the discussion document. Thanks, Clark. This slide just contains those portions of the section that contain areas that we think should be clarified. There may be others that stakeholders think should be clarified, but this deals with some of the definitional issues that we highlighted in the beginning of the presentation, homebound, alternative methods. In addition, it says that a program operator should provide alternative methods of collection from ultimate users for any covered drugs other than controlled substances that cannot be accepted or commingled with other covered drugs in secure collection receptacles through a mail-back program to the extent technically feasible and permissible. The next slide. Plan requirements, again, says that a stewardship plan shall include provisions to expand into jurisdictions not included in the stewardship plan pursuant to 42036.2 in the event a jurisdiction repeals its local stewardship program ordinance. Some of the questions we have regarding this section is, How will the stewardship organization identify which drugs cannot be accepted or commingled with other covered drugs? And should the process used to conduct this analysis be included in the stewardship plan? Again, this is not something that CalRecycle has expertise in, so we want to know, and also want to know for public disclosure, how the stewardship organization that's submitting this plan has taken that into account and how they've identified the way that these materials need to be collected. Additionally, does the term technically feasible need to be further defined? And we suggested it does up in the definitions.
And while you're thinking of comments or questions, I do want to just, again, draw your attention to section 42032.2, which is what this is about. And there's a long list in the statute of the different kinds of provisions that need to be addressed in a plan, you know, including funding, collection system, handling, transport, provisions for a mail-back program if it's appropriate, the alternative methods. There's a lot of things that are listed in that section that will be required in a plan. So Cynthia just gave a few examples. And I just want to make sure you're well aware that it's a longer list that will be required. So any comments on the first two questions, or do you want to move on to these three, the second two?
Yeah, I'll go ahead and just highlight the numbers 3 and 4. So what are examples of when an alternative method would be necessary? How many alternative methods of collection should be provided? And regarding 42032.2E, what provisions are necessary to consider for expansion into a jurisdiction in the event that an ordinance is repealed? Again, this isn't an exhaustive list of questions. These are some things that came to mind. We wanted to generate discussion, but if anyone has any thoughts they'd care to share now, we would be happy to hear. Mr. Grimes?
Oh, go ahead, Larry, and then Bill.
Larry.
Oh, okay, reverse that order.
I think we'll comment more later, but obviously initially convenience standard differences between local ordinances and the state law in the event that there's expansion into those jurisdictions would need to be carefully considered.
And Larry Sweetser again, I think I'm adding on to Bill's question, and I'm not sure it's a covered material type question, but my question is regarding some jurisdictions already have established programs for collecting pharmaceuticals. And if they have, like one has more than 10 locations now, under the formula, they would only have to have 3 to 4. So we hope that there's a way to address that the customers are not going to lose service by having less kiosks than mandated.
So this, sorry about that, doesn't apply to counties that have existing ordinances.
Can you identify yourself and affiliation,
Jason Schmelzer with the California Product Stewardship Council. So it doesn't apply to counties that have existing ordinances. The repeal provision was included so that the companies could work with counties that have existing ordinances to kind of onboard them into the statewide program if they chose. So it's kind of an optional function.
Thanks, Jason.
Right, the county's program, and Larry Sweetser again, may be more robust, but if, as not part of the county program, a jurisdiction within that county or a regional agency wants to have additional services, how does that question fit into here? And I don't think there's an answer right now, but hopefully that would fit into it.
Okay, we're on slide 48. This is regarding 7A is regarding authorized collectors. What page are we on the discussion document?
11.
Page 11 of our discussion document. It states that at least 120 days before submitting a plan to the department, the operator of the program for covered drugs shall notify potential authorized collectors. Operators shall commence good faith negotiations. A retail pharmacy shall make a reasonable effort to serve as an authorized collector as part of the stewardship program. Some questions we have regarding that are what form of documentation should be submitted to demonstrate good faith and reasonable effort. So outside of just the definitional concerns that we addressed earlier, what documentation should be submitted to demonstrate that? Pause. I don't see any hands. Okay.
Go ahead, we got Bill.
Again, Bill Grimes with Santa Clara County. I don't know if you can stipulate this clearly, and I'll give it some thought, but the documentation that we received from our stewardship plan operators as to who they contacted, we then integrated to outreach from internal staff to try to be a partnership, a cooperative effort to encourage those sites that may, and some did, that may feel a little more comfortable with clarification of the messaging, that it is coming from a regulatory authority or a government entity in addition to what they may see as a solicitation from an outside third party for a service they don't fully understand. So I don't know that you'll have an easy platform to make that available to the jurisdictions where this applies, but having perhaps documentation come back demonstrating the contacts, the number of contacts, the attempts, maybe contact people and numbers, so that the jurisdiction then has that opportunity to reach out to them and say, hey, I noticed these folks contacted you, here's what this is about, and would you really, is there anything we can do to help you reconsider participation? We found that effective.
Thank you.
That's very helpful, and I'll just observe too that there's certainly a lot of value to that coordination and that joint approach of these potential participants. And the way the statute is constructed here, it's basically if a potential collection location reaches out and expresses an interest, the program operator needs to work in good faith. And I think one of the questions we're trying to tease out is, what should we, are there things we should ask for from the program operator to demonstrate that they've worked in good faith with that potential collection site to come on board? Is there documentation we want? Are there specific processes within the plan we want that'll help us confirm that, in fact, there has been good faith on the part of the program operator to try to bring these collection sites online?
And clarifying some of these terms with either criteria or just definitional language is important for a couple of reasons. One is, as we move forward, we're obviously interested in regulated entities of all types being in compliance, and we'll work with folks to bring them into compliance. But if there is an issue where there is a question about whether someone is operating in good faith or making a reasonable effort, if we don't have that well defined in the regulations, then it's going to make it very difficult for us to take subsequent enforcement action if that's warranted. So we will have to be more specific about those kinds of terms as we move down this process.
Okay, I'll turn it over to Clark to talk about plan requirements for home-generated sharps waste.
Thanks, Cynthia. I can see we got a good bit of stamina here in the room. Everyone's still in their seats. Maybe we're losing a little energy, but hopefully we can wrap it up here.
3 more slides.
So there's lots of similarities in the plan requirements for home-generated sharps as opposed to plan requirements for pharmaceuticals that Cynthia just went through. For example, there's a requirement that the plan needs to include adequate funding for all administrative and operational costs. However, there are a few aspects that are unique to a plan for sharps that I want to draw your attention to. First is that the plan needs to provide for a container and mail back materials at point of sale to the extent allowable by law. And we have some questions about that, the extent allowable by law. It also requires that the container and the mail back materials are sufficient for a volume of sharps generated over a selected period of time. So one of the things we're interested in getting some feedback on is that selected period of time. And then similar to the pharmaceuticals plan requirements, there's also requirements that a sharp plan include provisions that it could expand into a jurisdiction if they repeal a local ordinance. And we're really looking to get some thinking about what those provisions look like and what might be included in those provisions. Okay, so Specific questions we'd like some input on include, what are examples of when mailback materials would not be permitted under the law? And is there clarification or thoughts about, how we should approach this sufficient time period by which the collection container mailback materials will serve a home user? Looks like we have a comment from Landon up front here, or maybe.
So I had two questions for you. When you talk about home-generated sharps and pharmaceuticals, does that include the typical small business operator, someone who is incorporated on their tax return as an individual business and is not thus an LLC or a corporation? Because there's a large number of generators for what is considered to be medical waste in the state. And so I'm trying to understand, the scope of this program. Does it include people like that, as opposed to hospitals and clinics? That's obviously not part of this program. And then the second one is, there are all kinds of postal service, other types of regs and rules that would apply to particularly sharps when it comes to stuff that can go through the mail. And in terms of container volumes and sufficient time periods, those are also have to be considered within the context of the answer to the first two questions.
Thanks for that, Landon. I think we'll need, maybe offline we get some more specifics for you on the small business and kind of understand that situation a little bit for where the small business material might be generated, so we can give that a little more thought. With regards to the postal service or other common carriers that may be using these mailback containers, I think maybe what we could do is add that to our list of potential agencies that we need to kind of coordinate with and see if plans may need to be reviewed by them prior to submittal to the department, or if there's other specific rules and regulations that they have that we need some consideration of.
Thank you.
Do we have a?
Hi. Celine Hoboy with SteriCycle again. With regards to Sharp's mailback programs, I do want to point out that the U.S. Postal Service Domestic Mail Manual does have regulatory requirements. They have been approached on several occasions to maybe try to lighten those requirements for home-generated use, to take that into consideration. Unfortunately, they've been very reluctant to do that because they do have a very large employee population that they have to also take into consideration. So they've not been willing to take that, this is a home-generated sharps, into consideration. So anyone that's using a U.S. Postal Service container must still meet all those conditions, which is expensive. It's a 30-foot frozen drop test. All the requirements are in there. So I wanted to make sure that the department knew that. These materials, because they're home generated, are not regulated by the Federal Department of Transportation because they're exempt. And so there may be other options to U.S. Postal Service that should be looked at. But my recommendation would be, because they end up through those same channels in terms of transportation, for the protection of the program and for the protection of the department, you may want to consider looking at what are the requirements under U.S. Postal Service versus what private carriers are willing to do when these plans are being developed and the packaging is being offered.
Thanks for those comments, Lane. I think we'll benefit from some further conversation with you along those lines, to understand the options a bit more. And then the other question we have up here on the slide, which didn't generate a lot of feedback on the pharmaceutical side, so I'm presuming that's maybe the case here as well, but do folks have ideas about specific provisions that should be included in a plan for sharps that would allow that to kind of smoothly transition into a jurisdiction that repeals its own ordinance? Seeing some head shaking, so maybe Heather, you could move on to the next one for us. Okay. Probably a topic of interest to some folks is the requirements that the SHARP plan include reimbursement to local agencies for disposal costs related to home-generated sharps unless the program operator provides for the removal of home-generated sharps from the local household hazardous waste facility. Furthermore, statute specifies that reimbursement costs shall be limited to the actual cost of transportation from the household hazardous waste facility and for the actual costs of disposal. So if we go to the next slide. We're interested in thoughts about whether any of these processes require clarification in regulation or specifically to the reimbursement requirements. So should the regulation speak to issues such as frequency of reimbursement to local agencies, whether it's monthly or quarterly? Should it dictate what information needs to be included in those requests for payments? Or alternatively, if a program operator's providing removal services or removing sharps from a household hazardous waste facility, what's that look like? What's required to kind of remove sharps from a household hazardous waste facility? So I'll open it up to questions and comments on those couple issues.
Bill Grimes with Santa Clara County again. So we have a very different program than this for sharps, so it's hard to kind of wrap my arms around because we're going to be kiosk based. But a lot of our focus is going to be into education outreach to the residents coming to our HHW with sharps to know about those other services as they're implemented. But we expect to still get a fair amount of them. I think the best resource for us would be any kind of language that can require timeliness of service. We have space considerations. We're shipping 15, 20 drums of sharps at a time. The timing is critical. The trucking is critical. We work with Stericycle to make that happen, to facilitate that. It's not as amenable in that context as some of these common carrier, they'll get there when they get there during business hours kinds of pickups. So I think both to 1 and 2, the reimbursement path should be somewhat clear to help everyone involved, and then the removal process or the integration process with existing HHW programs, I know for us specifically would need to be pretty seamless to our existing program, and either be reimbursement or coordination oversight or something similar that's offered to be useful to us and not burdensome to what we already have.
Thanks, Bill. Robert Langdon had a comment.
Yeah, so depending upon how the back end of the process works, you could have a variety of different services for, doing this for each of the types. For example, if it's controlled substances, some of those require custodial pickup. And remember that sharps could be co-classified as being a controlled substance that just happens to be the vessel within which it currently resides. So I would recommend that you take a look at all that stuff in terms of reimbursement. Obviously, people that are performing your services would like to get paid promptly.
Jack McGurk. I'm a consultant, have my own company. And in response to your question regarding pickup of sharps from household hazardous waste facilities, that's already spelled out in the Medical Waste Management Act. And those are considered points of consolidation for home-generated sharps, and then they're handled as medical waste. So that's something you may want to look at. And if there's a conflict with what the Medical Waste Act says and what this program wants to do, maybe there's a consideration for cleanup of the Medical Waste Act. But there is, you know, just be aware of it so that what you're doing doesn't conflict with their act.
Thanks, Jack. I appreciate that.
And Celine Hoboy again with Stericycle. To kind of piggyback off of that, the other thing that's kind of funky about the federal DOT is that they don't recognize a household exemption when it becomes a commerce. So if it's a consolidation location that's a household hazardous waste facility that is being picked up by a commercial entity, then that entity would still have to follow DOT regulatory requirements. So I just wanted to make sure that that was clear. I'm not really clear on what the question is if people already had take-back programs and now we're going to a mail-back, is there some reimbursement? If that's what the question is, I apologize, but that's, well, I wasn't really understanding this part very well.
I appreciate your candor there. I probably wasn't being very clear. So if we look at page 13 of our concept handout, we have a gray text box with an excerpt of statutory language. And basically what it says is for a SHARPS program should provide for reimbursement to local agencies for disposal costs related to home-generated SHARPS waste unless the program operator provides for the removal of home-generated SHARPS from a household hazardous waste facility. And I'm paraphrasing a little bit there. And kind of, you know, from my perspective, understanding, you know, where is that transition point where it becomes removal and what's involved in the removal of that SHARPS material from the household hazardous waste. And, you know, if that's done, then the statute seems to say, you know, there is not the reimbursement because the program's providing the removal services. So we're trying to understand what that looks like and how that may function in practice.
I'm Sarah Hansen from Ultimed. I do believe this needs more clarification because as a manufacturer, if we're already providing the mail back, then at least the way I'm reading this, the way that it would show up at the local waste facility is if a consumer is not utilizing the mail back. And so are we responsible for consumers not following the regulation when we've already provided what's required by regulation and statute? So I would like to see considerable more clarification given here to your comment, Clark. How does this work in reality and practice?
Thanks.
Thank you. Any other comments on this? I know we have a couple of email. Oh, go ahead, Jason.
I don't know how to push buttons. Okay.
Really?
Jason Schmelzer.
Really?
Yeah, you'd be surprised. Jason Schmelzer with the California Product Stewardship Council. Yeah, I mean, the way that it was negotiated, there are kind of two requirements to the question from Ultimed. There's the mailback requirement, and then because we know SHARPS will continue to end up at local government facilities, this second provision was negotiated to take care of that problem. So it's either a pickup or a cost reimbursement structure.
And I will say that based on some of the experience we've had, particularly in the paint program, some of the contractual negotiations on whatever the parameters are going to be can be very difficult. So this is an area where we're going to have to look at it very closely and make sure it's clear for everyone. Yeah. I don't. Are you guys? Okay, you got more. Okay, then we'll get to Nikki. She's got some email questions. Okay. All right. I think we're going to go to you, Nikki.
Okay, we have 3 questions from Alexander Fung. He's with the San Gabriel Valley Council of Governments. The first question is there a regulation in place that require a program operator to outreach to individuals experiencing homelessness regarding where they can request prepaid and pre-addressed mailing envelopes or an alternative form of a collection and disposal system?
The short answer is yes. We talked a little bit earlier about the homebound definition that's used within the statutory language, and we will look here for our page number. So on page 2, our discussion document is where we identify a potential definition for homebound. That's one of the terms that we think may benefit from further definition and regulation. We've included here an example definition from the Medicare program, and maybe I'll let Cynthia read off the specific statutory citation for where it's addressed.
Yep, this is Heather, and I think more important than the definition of homebound is there is a provision that permits an ultimate user who is homeless to request prepaid and pre-addressed mailing envelopes or an alternative form, and that is through an internet website or toll-free phone number that the stewardship organization will provide. So what that mechanism looks like, how they will provide that to that community is, I think, on for the stewardship organization to create.
So that may be one of the nuances or sub-provisions that needs to be included in education outreach portions of the plan.
Okay, second question. A lot of our city council members are concerned with the collection methods of different brands of covered drugs. For example, would a resident that is trying to return an expired Allegra medication be able to return a drug at a collection site designated for another brand of drugs aside from Allegra?
It's probably one that we're going to have to talk about, but I think in general, the stewardship plans are not brand specific. We're looking at an organization coming in to provide a program that's going to collect all kinds of whatever the covered, in this case, covered drugs are, as opposed to specific brands.
And I'll just add to that we did speak a little bit during the plan requirements about the fact that if a drug is identified as not being able to be commingled with something else, that the plan needs to provide alternative methods. And so I'm not sure if that would apply in this instance, but there's certainly going to be some requirements that if you can't commingle, that there's alternative methods provided.
Bill Grimes with Santa Clara County. To those two questions, I would encourage you to have consistency if you have multiple stewardship plans submitted, that they be not brand specific and just collect all covered medications. And secondly, I think putting some guardrails around how that mailback system for sharps works for the homeless population would be helpful. I don't think having an internet website or a toll-free number and not having a mailing address is going to be able to impact that population. So I think you might want to have some specific language tailored to community outreach organizations and social services that offer those services and provide resources to those populations to be able to request appropriate numbers of mailback containers to distribute among that community.
Hand in the middle of the room.
Hi, good afternoon. Rob Reynolds. I'm with Verde Technologies. We're the makers of Deterra, the drug deactivation and disposal pouches. So first, I'd just like to thank you for your work on this and thank you for considering at-home disposal pouches as an option for any of the groups creating a plan that may be able to address the issue we just spoke of with the homeless, or would actually help complete and round out any other plan that's dealing with other take-back methods.
Thank you. Nikki, was there, oh, go ahead, Langdon.
Yeah, I'm right here.
Take the mic, please.
Thank you. Just, I wanted to understand how your state regulations apply to collection programs or other ideas on Indian tribal lands and/or on federal lands.
Well, I'll put my chief counsel on the spot for that. Make you earn your pay, Mr. Block.
They don't.
Yes. The last question was, what can local governments or cities do to prepare for the promulgation of SB212's policies in 2021? What else can cities do to raise awareness besides hosting take-back days?
What was the last phrase?
What else can cities do to raise awareness besides hosting take-back days?
Well, certainly, I mean, I should ask, and I don't know what's on the webcast, but how many of you are from local government? I know a couple, maybe 3 or 4, 5, which is what I thought. I suspect that as we move more into this process, we're going to get more and more involvement from local governments, whether that's through CSAC or League of Cities, but they'll be involved as well. So I think there'll be a lot more outreach. We need to have more outreach to all the folks who are involved in this program, whether it's jurisdictions or manufacturers or some of the other covered entities. So that's why we're going to need help getting the word out via your own distribution list as well. So I think there's a lot of communication issues that we have to expand upon, let alone substance of the regulations, to make sure everybody's aware of this and is thinking about, what do they need to have covered in these regulations, and what are their perspectives. In terms of, I'll just say we have a large network. We regulate jurisdictions in terms of their recycling programs. These are probably some different programs than we are used to dealing with, but we have an extensive network to get the word out in general to recycling coordinators and local jurisdictions. That may be one step that we can take, and there's a lot of others that you all have wherewithal to get the word out as well. So we need to coordinate on that. Heidi?
This is Heidi Sanborn with the California Product Stewardship Council, and I just wanted to answer that question that we've got a whole listserv and a whole campaign called Don't Rush to Flush, Meds in the Bin, We All Win. And I think we've put out over 70 medicine bins. We're working on putting another 270 out with the Department of Health Services in the next few years. So there's lots we can do together to promote what is happening already, and we are working on a needles location drop-off map as well. So, and we've already got one for medications for the state. So hopefully they can follow us on Don't Rush to Flush.
Great, thank you. And I will say that generally, as part of our implementation of regulations, we do go out on the road and we provide guidance to whoever, whether it's going to manufacturers, going to jurisdictions, different organizations. We haven't had a chance to think about that yet, and this is something that we'd start thinking about when we're well into the regulatory process, and then thinking about, well, what do we need to get in terms of information, guidance, tools, and things like that. That's something we'll have to plan for. We'll want input on what's needed. We're not there yet, but certainly this is a start on that conversation. That was it on the questions, right? Okay. Any other comments before we wrap up? I think we're at the wrap-up stage. Is that right? Oh, go ahead.
Thanks, Heidi Sanborn again with the California Product Stewardship Council. I just want to thank CalRecycle for moving so quickly to get this workshop going after the regulations, or getting started on the regulations after the bill passed. And I really want to thank everybody who helped negotiate the bill, everybody who helped pass it, and all the stakeholders here, because this is how we're going to have a good process and a good outcome for everybody. The state really needs these programs. The public is eager to get them. We're getting calls literally every day from all over the state. When are the bins coming? When are the programs coming? So I just want to thank everybody for working together and having a very constructive day. Thank you.
Thanks very much, Heidi. Appreciate that. We have some wrap-up information. We're way ahead of schedule. We were scheduled until 5 o'clock, so there's still opportunity if you want to provide comments. I will say that after we're done, please make sure, come on up, we'll stick around. We want to know who among you wants to meet with us individually as a company or an organization. Also, start talking to us about if you're an association or an entity that is thinking about being the stewardship program operator. We want to talk to you early and identify folks and work with you early on. So there's a lot of different avenues for communication here.
Okay, thanks. I'll just wrap up with this slide that just outlines what we've already stated a couple times earlier. We're having our next informal rulemaking workshop, the number 2, on Articles 4 through 7 on the 27th, and April through June, holding those second and third workshops both in Sacramento, all in California, Sacramento and down south in the Los Angeles area, beginning formal rulemaking this fall to be done no later than January 1, 2021. So again, also just want to state that we would like comments on Articles 1 through 3 by the 15th. That's not a hard deadline. We'll take them whenever we get them, but the earlier you can get them to us, the earlier we can start thinking and asking better questions and gathering more research on our end. Thank you.
And I would add that if you do submit comments in writing, we have this email here, pharmasharps@calrecycle.ca.gov. Make sure you send them to that email because we will all look at that. Certainly you're welcome to provide additional comments later. We know this won't be the first time or the only time you're going to have input. You may have some initial thoughts that, we need to look at this or that, and then later on you'll have more specifics. So this is going to be a very iterative process with you over the next 6 to 8 months as we develop the regulatory language and move into the formal rulemaking. So I guess with that, I will thank you all on the webcast for joining. Thank you all for being here in the room. I think we got a lot of great feedback. This is what we're hoping for. And we'll see you on February 27th, or if not sooner. Thank you.